The current lockdown restrictions across the UK are due to be reviewed again in 2 weeks' time. Downing Street is not giving any indication of options that are being considered, but today Scotland's First Minister, Nicola Sturgeon, gave a glimpse of what could be ahead as she outlined possible ways forward in Scotland. They include classrooms being redesigned and not all children being in school at the same time. Businesses would have to ensure that staff could work 2 metres away from colleagues. And she said there might have to be different approaches for different areas of Scotland. The First Minister warned that any or all of these options might have to be reversed, and she was, of course, setting out proposals for Scotland. Here's our political editor, Laura Koonsberg.
That was then, and this is now. Busy streets, now empty avenues. Traffic lights, strange statues on roads with hardly any cars. But what might be the long route out of lockdown? In one part of the UK today, the sketch of the beginning.
I'm seeking today really to start a grown-up conversation with you, the public. Talk of lifting the lockdown as if it's a flick of a switch moment is misguided. Our steps, when we take them, will need to be careful, gradual, incremental, and probably quite small to start with.
Schools and some firms could start to open up, but in limited ways, with different days for different staff or children perhaps, so everyone can keep their distance. Some kinds of outdoor pursuits might return, but forget anything like a normal match day where thousands cram together. And for the most vulnerable, those in ill health or very elderly, the instruction is likely to remain for a long time. Stay at home.
You've said today it's only right you treat people like grown-ups. Do you think the government in Westminster risks treating the public like children if they don't share their thinking in the way that you have today?
These are horrendously difficult decisions for all governments, not just across the UK, but all governments across the world. There are no absolute rights and wrongs in this, and it is incumbent on all of us to try to involve the public in that as much as possible. That is what the Scottish Government will do at every step of the way, and I believe that is what other governments will seek to do as well, and I would encourage governments everywhere to do that.
Ministers here are reluctant to give much away for now, although they've set out 5 tests. But they're being pushed by Labour and some of their own MPs to open up.
There is broad public support for the lockdown, but the Scottish First Minister, the opposition, and some of your own MPs think you should be more transparent about what might come next. Are they all wrong?
I understand the thirst for knowledge, but the tests that we've set out, which are the basis from which others, for instance, the Scottish Government, have then developed their plans. Those tests are the critical tests for when changes can be made. We haven't met them yet, and therefore we must keep the social distancing measures in place.
On the way in, as the faces of our towns and cities started to change, different administrations in the UK stuck more or less together, seeing the same data, sharing the same scientific advice. But on the way out,
you could well see different parts of the United Kingdom move in a different time to other parts, because we'll be criteria-led.
But that's the when, not the how. As limits on our lives have slowed the loss of life everywhere, the economy is in jeopardy in every corner of the country too. All parts of the UK could look different on the other side. Laura Koonsberg, BBC News, Westminster.
So any attempt to ease the lockdown will only happen when ministers and their scientific advisers are convinced that the spread of the coronavirus is under control. Our science editor, David Shookman, has been looking at how that might be achieved.
Everything hinges on how rapidly the coronavirus spreads and on how we try to stop it. That's what all the restrictions are designed to do. As we keep hearing from the scientists tracking the pandemic, and now from the Scottish Government as well, the key factor is the rate of infection. At the height of the outbreak, it was running at about 1 to 3. That means if one person's infected, they could pass it on to up to 3 others. Since then, that rate has been driven right down below 1 to 1 and may now stand at something like 0.7. No one's entirely sure. Now, if you ease any of the restrictions, for example, reopening schools, you nudge the rate up a bit. The key thing is that if you get above 1 to 1, you run the risk of the virus taking off again. Keep it below and the outbreak is contained. So, How do we move forward from this? Essential in any strategy is mass testing to discover where the virus is spreading. There are different ways of doing this. Researchers in Munich are checking people for antibodies. It's a blood test to see if they've had the virus. A similar project is starting here. Then there's testing for the virus itself with a swab. 20,000 households are being asked to take part, a crucial way of tracking the outbreak. And alongside the testing, there's the job of tracing contacts. In the Chinese city of Wuhan, 18,000 people checked everyone infected and followed anyone they were close to. And a similar number will now do the same in the UK. It's how environmental health inspectors work. When they track down infections from contaminated food, it's vital for a quick response.
It is detective work. Actually, it sounds as though covering a country like ours would be an enormous feat and impossible. But actually, our first cases of coronavirus were picked up by our flu surveillance team. So this is a routine that goes on. This is obviously on a much larger scale.
Another strategy could be encouraging the public to wear face coverings. This animation shows how far a cough can linger in a supermarket. Wearing some kind of mask could limit the spread. Government advisors think there could be benefits.
For people who are coming into contact with a large number of people during the day, such as shop workers or people working on public transport, there probably on balance would be a case for them to wear a cloth mask. On the other hand, those of us who are walking around the streets, in the parks, just everyday business, probably the balance of probability goes the other way.
But for the moment, the lockdown remains the central strategy, a crude but reliable way of reducing infections. And that'll continue until the virus itself is brought under much firmer control. David Shukman, BBC News.